The first part of this week's lesson is on a basic head CT. Now in the CT room, you may see a positioning pillow like this, and it's positioned on the table with a sheet over it. Now I have a little short video on how to position the patient for a head CT. I'd like to say thank you for Alicia. Some of you may recognize her for being my patient. I'm going to lay the patient in a supine position, which is flat on their back, with their head in the positioning pillow, their arms across their chest to help keep their arms steady and keep there from being any movement. There's a series of buttons on the gantry that you're going to push. Some will help you move, some will help you use the lights. We'll go over that a little bit later, but here we're moving her up. And this is just a view of when you move a patient up or down, what numbers change, and that's those top numbers. Now typically to have the patient in the correct position coronally, those numbers are going to be set at 200. The numbers that will pop up below the numbers that are changing are the axial position of the patient, and the 2 zeros at the side, that's the table angulation. And this is moving the patient in. We'll press on those two buttons. Like I said, we'll go over that a little slower later on. You can see the patient moving in. I've turned the light on. And we want the patient positioned so that you can use the outside or inside light. I'm using the inside light. The inside light axially is going to be at the orbital meatal line. The light sagittally will be at the mid-sagittal plane, and the light coronal will be right on the EAM. Now there's the button that you push if you're setting that inside line. So this is what the patient looks like once they're inside the gantry and positioned correctly. Again, there's the number set, what they look like. The top number is the position of the patient up and down, and you can see that displayed beside the numbers. The numbers that will pop up below are the position of the patient axially, and then the two numbers that you see separated by the decimal point, the 2 zeros, that's the table angulation. Here are the buttons that we were talking about using during the patient position. This first set button is for the light, to turn the light off and on. The second set of lights buttons are to mark which line you use, whether you use the outside positioning line or the inside positioning line. These buttons move the table. When you press just the outside buttons, it moves slowly. If you press the outside button in conjunction with the inside button, the table moves faster. And these two buttons are to angle the table. Now again, this is what the patient looks like when they're in the correct position. And these are your lights. This is so that you can see the axial and the coronal positioning. And here's your sagittal and axial positioning. This is what it should look like. Now, if you were going to use contrast and do a contrasted head study, you'd use 100 milliliters. And this is what the injection screen would be set at. Usually a 2.0 flow rate. Shows that the volume is 100 and shows that it will take about 50 seconds for it to go in. You typically do a 60-second delay for heads. Now you know how to position the patient inside the room using the gantry. Now let's go to what it looks like when you're sitting down at the control panel. This is the screen that you will see to your left, the left monitor. You're going to click on this button to bring up the new patient. And this is the screen that you will see. You're going to click on Patient Schedule to bring up the patient schedule. And you're going to click on the patient that you want. This screen will pop up. It will have all the patient information, and then you're going to tell it what procedure you're doing. And right now we're doing a routine head, so you would click on that button, and it will bring up this screen, which is your scout screen. Now, if you have any questions about how to position the patient, look here. It shows you that you want to mark at the orbital meatal line. Your inside or your outside line is going to be marked there, that the patient orientation is head first and the patient position is supine. Now the scouts that you're going to do are a lateral scout and an AP scout, and you're going to use these images to set your procedure up. And in order to do these scouts, you're going to hit confirm, and then you're going to look down at your keyboard. You're going to push on this button to move the patient into position to start the scan, and you're going to push this button to start the scan, and you will do this for each scout. Now you want the correct window level to pop up, so you're going to push on this button, which will bring up the head window level. Now once you've done your scouts, this is the screen that's going to pop up, and this is your protocol screen. We've talked about this before. In order to set up your scan, you need to localize the area that you want scanned. This is where you tell the machine, I just want this area scanned. So you're going to push on the Show Localizer button, and you're going to position your localizer like this on your AP, and you'll use the page up and page down to go between your two scouts to set up your localizer, which are the lines. And you'll set up with the lateral also, and you want to angle with the base of the skull. Again, you're going to hit the confirm button, and then you will go to your control panel keyboard, and you will push on the button to scan, to move to scan, and the button to scan. Again, making sure that you're on the head window level. And when you're done, you're going to have a head CT scan. Let me go back.